for our audience unfamiliar with laser resurfacing, could you explain what it is and how it benefits the skin?
Absolutely. So when we say laser resurfacing, we're really talking about anything that we do to the top of the skin. So in fully ablative laser resurfacing, you take that whole top off. And when you do that, the skin repopulates from cells that are deeper in the skin, and those cells aren't as damaged. So that is probably the best thing we can do to improve health for the skin, because we allow newer, younger, better cells to repopulate. And we actually decrease their incidence for skin cancers. And there's a lot of other great side effects besides just the cosmetic benefit. The health benefit's huge. Now, the other thing we can do is, because that's a big deal procedure, and wound care, everything, you're hiding a solid week. The other thing we can do, and Rox and Deena Randstein came up with this, is poke thousands of tiny holes into the skin. And we can do that in a variety of different ways by different lasers with different energies, different densities, different spot sizes. So you can pick how big the holes are that you poke into the skin, which can create channels. And those channels will then allow delivery of products into the skin, or just allow healing, even if you didn't put anything on top to deliver in. If you just poke the holes, the skin does what it does, which is heal. It'll turn darker areas light, lighter areas, give it some pigment back, like if for some reason you've lost pigment. It will even it out. So if you have scars that are rough, and it could be a surgical scar, it could be a burn scar, it could be, a traumatic scar, you can then remodel the skin and improve the look of that skin and the function of that skin.
It's all about cell manipulation, and of course, you have a big laser beam at your disposal. So of course, you are going to get the effect that you want. Now, in your practice, how do you determine when laser resurfacing is the preferred treatment compared to other available options? And curious to know, how do you combine this with CO2 lift?
Sure. Well, the first thing is a conversation, because no matter what you use after, what you're doing at that time determines the expense to the patient, the pain, the downtime, wound care. So a fully ablative procedure is sort of the max of all that, max benefit, but it's the most downtime. It's uncomfortable. We give them drugs. We get them through it fine. But their wound care is significant as well. So number one, actually, before we even make the wound, we prep the skin. And so we do things like maybe lighten, if you're a darker skin type, maybe we don't want you to pigment as much. There's like hydroquinone, retin-A, things that we can do to prep the skin and get you ready. Now I'm going to do a procedure, and then I've got to take care of that procedure after. So from that point on, depending on if it's a fully ablative, I've got to be very careful, right? Because I've taken off that whole barrier of skin. So I've got to let some of that come back before I can put too much on topically, because I don't want to irritate you. Something like the carboxy lift can actually enhance healing. So it can make it an oxygen-rich environment. It can promote healing. But I also have to be careful with what is present there, because I don't want to irritate that brand new skin that's there. So for a carboxy lift, you could do that right after a regular Fraxel, or you could do that after some things. But if I have a fully ablative procedure, I might just want to let you heal in a little bit, make sure that you get some barrier function back, and so that you don't react to too much. And then we can do the things that can enhance more healing. So there's a lot of things that we can do to enhance healing. And I think anything that we can add to our armamentarium to make that downtime less, the wound care less, pain less, shorten the whole wound care time, that's a benefit.